Blessings to all the amazing people watching and listening to this. Welcome to CHEZUBA Talks, a podcast dedicated to sharing compelling stories of hope, determination, and humanity. Every tooth in a man's head is more valuable than a diamond, wrote Miguel de Cervantes. Having teeth and the ability to use them in a smile is something we all have in common. But not everyone is lucky to think of teeth when survival is a priority. Least so when dental treatment is so expensive. Hello, I'm Tej, and I'm very eager and curious to have Jon Kozesky as my guest today. Jon is the Executive Director of WHDO, the World Health Dental Organization, a U.S. nonprofit humanitarian organization whose mission is compassionate dental care and education for communities in need. Welcome, Jon.
Good morning. Thank you so much for having me today.
The WHDO provides free dentistry on the Mara since 2008. That must be an exciting and rewarding experience, to say the least.
Well, certainly to say the least. We are very fortunate, as you just said, to be coming up on our 15th anniversary of having our clinic in the Mara in rural Kenya. And, to see all those years of faces and smiles that we've been able to create and maintain, it has certainly been a rewarding adventure, to say the least.
Yeah, people out there listening to this and watching this, I'm sure they're excited to know what exactly do you do when you say World Dental Health Organization and the Masai Mara. Everybody just thinks of animals when they think of Masai Mara, right?
Well, that is 100% true. And as a matter of fact, our clinic is located very, very close to a world-renowned game park for safari. But that safari ends up right outside of our doors quite often with elephants and giraffes and everything you could imagine. But there's also an incredible population of people that live in and around that area as well. And as you can imagine, in that part of Kenya specifically, dental care is very hard to come by. In the entire country of Kenya, which is roughly about 44 million people, there's less than 4,000 dentists anywhere. And to give you some comparison, there's nearly 20,000 just in New York City. So there is a real need in the country, particularly in this rural area. So World Health Dental, we are a free clinic. All year, we are staffed with volunteer dentists that fly in from all over the world. They spend anywhere from 2 weeks to 8 weeks, spending their time 8 hours a day providing emergency dental care to individuals from the neighboring community. But the work doesn't really stop there. It's equally as important to us to try to get ahead of that emergency dental care with our educational outreach programming. So trying to do preventative care, trying to educate new mothers, the importance of dental care on their babies, trying to educate in schools and classrooms across the region, the importance of dental care, what brushing and flossing does and why that's important and what that can prevent and what it can provide in a lifetime. So all of that work combined is World Health Dental Organization.
You're doing wonderful work. Tell me, before this started, what was the situation? Did people even know what dental health is? And did they even know that there's a doctor for teeth?
What's interesting is there's different elements to that, Tej. So first and foremost, there are some historical elements to the community around specific beliefs in dental care. There's even a very old practice called dental mutilation, in which they feel that it's important that they extract certain teeth in order to promote other health elements. So trying to break through some of those cultural barriers to explain that those health elements aren't there. And in fact, they can cause infection and a lot of other problems. But then to take that a step further and to educate on the importance of cleaning, what that can do for a lifetime. Because as some people know, certainly all health starts with dental health. It can lead to a lot of other problems if you don't take care of your teeth. And then to take that, a step further in the we live in a vain world. And so when you're trying to get employment, when you're trying to be a professional, as many of these students are growing up to be now in the 21st century, helping them to understand that, having a healthy smile is going to help you in that employment as well. So there's a lot of different elements at play.
Right. And I also heard that a Maasai girl cannot get married till she has a beautiful smile. Is that true?
There are some rituals that still abide by that. There's, as you can imagine, we are guests in Kenya, and we are certainly guests in the Masai Mara, even though we've been there for nearly 15 years. So, we want to be respectful of rituals. We're not coming in to completely change the world, but we're trying to change it at least one smile at a time.
That's wonderful. Who started this, Jon?
Yes. So our clinic was actually started by an individual. He was called the Safari Dentist, and he was, and so he was essentially going around rural Kenya on his own with a traveling clinic for I want to say nearly 20 years, providing these dental opportunities before actually setting down roots and saying, we're going to build a clinic and we're going to stay here. And so, a lot of credit to Dr. Ray and his wife for everything that they were able to make happen. And a lot of credit to the team that he put in place, his board of directors and volunteers that have maintained it now for 15 years. And we certainly plan to be here 15 years from now.
Super. You have this entire setup there. You have a clinic, and looking at the dental care today, you have all these materials that are changing every day. You have better composite material. You have better tooth alignment devices. You have better bridge, material. So, how do you keep up with the work over there? Is it up to date, or is it something that is donated across the world?
So it's a little bit of both. A great question. And certainly we try to stay with the changing times. And to anyone that is to visit our clinic, I think you'll be as amazed as I was the first time I stepped in the door, because I hesitate to say state of the art because that changes by the hour, but it's about as close as you could possibly get. It looks like it was actually a lot nicer almost than the dentist that I go to here in Washington, D.C. And that was a good thing to see. But, that's maintained a lot by, first and foremost, the incredible donations that we receive from across the country. Financial donations make those purchases possible. We also have some corporate partners who will make donations of equipment and materials and pharmaceuticals that help to maintain our level of service. And then the last part that you touched on really is our dentists. So when a dentist is coming, more often than not, they'll say, what can I bring? What do you need? I have my clinic. I have friends that have clinics. Are there pharmaceuticals that I can bring with me? Is there instruments? Is there technology? And a lot of times, more often than not, that's how we've grown our clinic's technology. And it really, really is incredible that people are willing to not just offer their time, which is their most valuable commodity, but also the resources of their clinics as well.
That's wonderful. When you talk about giving state-of-the-art, like you say, the best treatment and best materials to this community there, nothing speaks louder than that. You are doing the best that you can. The other question that occurs to me is when you have a situation like this, when you know that the people over there barely know what dental treatment is, do you get dentists who want to add to their experience but do not have too much of experience, because the new ones or fresh dentists, do they come in, or is there a selection criteria for people coming in for the 2 weeks or the 8 weeks?
Oh, absolutely. We want to make sure, first and foremost, the safety of our patients is a top priority. Just because they don't have alternative dental care, we want to ensure that they have the best dental care. like I said, first for their safety, but second of all, for a lot of them, this is their first experience with a dentist. And if they have a poor experience, then they're not likely to come back, and they're not likely to educate their children and families as to the experience that they had, much like you or I would have in any situation in life. So we are very cautious with who we approve. We certainly do our research. We do our background checks. We make sure that they're licensed practitioners. And we also ensure, to the best of our abilities, that they are licensed. They receive their temporary license in the country of Kenya. So there are a lot of procedures, and I hesitate to say hurdles, but safety precautions that are in place to make sure that this is a great experience.
Okay, so did I get that right? They need to be certified in the home country as well as in Kenya? Is that what it is?
That is correct. So they must have a license in their home country, and then we also ask them to go through the process of receiving a temporary license in the country of Kenya as well. And certainly we help them to as much as we can to guide them through that process.
Oh, that's lovely. I mean, that's a foolproof way of getting sure that you get the best. That's
absolutely.
Typically, what is the number of patients that come to the clinic every day or maybe in a week, and what are the common dental problems they have?
It can vary greatly. So it's very interesting. Anyone that's to visit our clinic, we operate a typical 8-hour day, 8:30 to 4:30, and by 7 a.m. You will see that individuals are starting to line up at the door. That's how important this process is. And that line is there almost every day. But I would say in a given day, only because of the time that we spend with each individual patient, a typical dentist will see anywhere between 15 and 30 patients in a day, which is pretty substantial. And unfortunately, at the end of the day, while we try our best not to turn anyone away, very often we have to at 4:30, and honestly, that's for their own safety, because a lot of patients and a lot of our local staff, they walk to the clinic. And it starts to get, in Kenya, it gets dark very early any time of year. And so to ensure that they can walk home safely while it's still light out, a lot of times they, have to come back the next day. But the procedures that happen, more often than not, they are emergency procedures. So we're talking a lot of extractions and things of that nature. We certainly do bridges and root canals as well, and try to work in that preventative care as best we can.
Age, young people, children, adults, older generations.
That is always the most amazing part to me, is it completely varies. In my time that I've been there, I've seen children as young as 7 or 8 years old. And I've seen senior citizens well into their later years. So it really is a cross sample of the community, which is, it's exciting on a certain level to see that outreach is working across the community. So both in schools, students that are taking that information home to their parents and sharing with their extended families, and honestly, just our reputation in the community. It's very interesting. We have a large vehicle that transports our dentists back and forth, and it's branded with our logo on the side. And I joke, it's almost like being in a parade every day, because the community waves and they smile. They recognize the logo. They know who we are. And they're genuinely appreciative of what we're trying to do.
Let's take a break to understand what CHEZUBA is. Everyone at some point ponders on how this beautiful life can be made more meaningful. Maybe you're a leader trying to enhance your employees' experience at your organization. Or you already work for the community and seek volunteers with state-of-the-art skills to strengthen your nonprofit. Whatever your situation, know that you can make a difference. CHEZUBA began with this very vision, a vision to facilitate every skill and every passion in the world in meeting a social need. Corporate volunteering has several benefits for both businesses and organizations. In parallel, experienced and enthusiastic volunteers join NGO workers, enabling them to serve the community more effectively. CHEZUBA offers everyone looking to add purpose and meaning to their lives, a chance to connect or volunteer virtually with non-profit organizations from over 100 countries around the world. Visit www.chezuba.net and explore opportunities to find meaning. CHEZUBA, your platform to do good. And now, back with our guest. I'm sure it's a transforming experience. Yeah, it's a transformational experience. Everybody going there, doing the work, of course, doing charity work and getting the love of so many people. I'm sure it's a very rewarding experience.
Well, I always say, I go back to my first experience visiting the clinic, and I've been very fortunate to have traveled much of the world. But, when I was told rural Kenya, I didn't really know what to expect. I said, well, that's, 6 hours outside of Nairobi. And, every dentist asks us the same question first, is it safe? And that was the first question that I had. And within my first day being there, I thought to myself, what a silly question that was, because this community could not be more loving. They could not be kinder. I honestly joke now. I say I felt light years safer there than I do on any typical day in Washington, D.C. So it is a wonderful place. The love and compassion that they have for one another, that they have for us being, who am I? I'm just some outsider in their community, and they could not be more welcoming. And that is a transformational experience.
Absolutely, yes. Speaking the language, expressing in actions is one thing. Explaining what the problem is with the tooth or what the symptoms are is not going to be an easy task for somebody who's completely new. And within 2 weeks, obviously, nobody's going to understand the language. So how do you cross that barrier?
Absolutely. So Kenya is a very interesting place, and particularly the Masai Mara area, because there's certainly a lot of English in the major cities like Nairobi. Once again, in the rural areas, Swahili is the most common language, and then the Masai Mara has its own dialect as well. So really, we're talking 3 different languages barriers that we have to get across, and we're very fortunate. A couplefold. A lot of our dentists tend to be bilingual, which is very helpful. But to take that a step further, all of our local staff in the clinic, so we have 3 assistants, we have a clinic manager, we have a number of additional staff on the grounds. They are all trilingual. So they speak all 3 of those languages and are able to translate for our dentists what it is that the issues are and how we can best address them.
Right. Have you ever thought of training people as dental hygienists, or the basics of what you require at the clinic? Maybe the youth there.
So, we're very fortunate. Our 3 dental assistants, while they're not hygienists, certainly are very well trained in a lot of the things that would make them certified hygienists. And also at the same time, one thing that's very interesting to me is that a good number of our dentists don't come alone. So a lot of them will bring a hygienist with them or a fellow dentist that's able to do some of those additional services as well, while the main dentist is focusing on the emergency dental care.
Oh, that's great. So it's not recommended, but most people do end up bringing them.
Yeah, absolutely. And certainly, we have plenty of dentists who come on their own and enjoy the experience. But as I always like to say, if you have someone you can bring with you to share this experience with, because it is just so incredible. And by and large, across the board. I mean, the work that you're doing, the individuals you see, but also to be living in the Masai Mara for 2 weeks or 4 weeks at a time. And there's families of monkeys and baboons that are right outside your door. Like I said, to sip your coffee in the morning and look out and say, is that an elephant? Oh my goodness, that's an elephant. Back here, in the United States, almost like when we see a deer and we all stop and, try to take it in. And so it is a wonderful experience.
I'm coming to that part a little later. When you talk about, you are all, when the dentists come there, they're basically medical doctors. So apart from the dental issues, do they also help with other minor ailments because they happen to have the wherewithal and the ability to do so.
Certainly, if it's within reason, if it's within their wheelhouse to address, we're not turning anybody away. We're not doing physicals or anything to that extent. But certainly, if there's certain other issues taking place, we're not going to let those go unaddressed with at least some unofficial medical advice before they depart.
Right. Okay. And all this is free of charge.
Absolutely. We charge none of our patients anything, because certainly, resources are hard enough to come by. And we are very fortunate that thanks to donations and some grant writing foundations that have funded us and wealthy individual donations that have been rather significant to our clinic as well, we are able to provide everything free of charge.
That's amazing. Now let's come to the fun part. What happens after the work hours and what happens on the weekends?
Oh my goodness. That is, that's the surprise part, because you come into this experience and you get so much Monday to Friday, 8:30 to 4:30, and every day. I mean, I'm not going to make it sound like it's not work. You're tired at the end of the day for sure, but you're energized because oh my goodness, that was such an experience. And then what we try to add on for all of our dentists and volunteers that attend is, as I mentioned at the beginning, we're just footsteps away from the gate to one of the most incredible safari parks in the world. And our clinic manager is a certified safari tour guide. And so every Saturday and often on Sunday too, we head into the game park for a 6 to 8 hour safari adventure. You certainly are all but certain to see the big five, which is all the major animals that you come in there to see. But then just to see even if it's not the Great Migration, but the minor migrations that happen with all the zebras and giraffes and elephants, it is just it's a remarkable experience. And to have that resource available, as an added benefit to our volunteers, just to make that experience just slightly more memorable. We're really glad that we can provide that.
That's so great. I'm feeling so bad I'm not a dentist. But tell me, you say that, you could see the migration, you could see the big five. Now, obviously, there are seasons there, right? There's this monsoon season where it's constantly raining, and there could be a season which is very dry. I can understand the dry season, but how difficult is it in the rains? It's generally about 2 months out of the year that is the rainy season. Now, certainly if you're, for example, if you're from the United States and particularly the Pacific Northwest, the Seattle area where it rains every day for 12 months, it probably will seem just fine to you. But for the rest of us, it's difficult. It can certainly make things a little treacherous to get around because of a lot of dirt roads and things like that. We certainly transport in an all-terrain vehicle, which makes that much safer. So the vast majority of our operations continue. For our patients, certainly it makes the travel to and from our clinic a little bit more difficult. They have to plan their trips a little better. But for the most part, our operations completely continue as planned. That's wonderful. Great. I'm so happy to have talked with you about this experience. I have never heard of something like this. And I have already recommended 2 of my dentist friends for this program. Let's see if they apply. And if they need an assistant, then I am coming in there.
That is too kind of you. Well, thank you for recommending them. And we would love to have you anytime. So hopefully they sign up and we can host you as well.
I will. I'm sure they will, because this is an experience that I think nobody should miss. And getting to see what most people aspire to see and being able to give back to the community is something just amazing. I think everybody should just go ahead and get into that program. Talking of which, are you really, really crowded? I mean, are you spoiled for choice?
So we are pretty well staffed. So normally by the beginning of the year, by the end of 2022, we'll have most of 2023 mapped out. Now, that being said, we certainly, cancellations happen, plans change. So I always highly encourage, if you're a dentist, if you're interested in getting involved, reach out anyway. We may have an opening, and if we don't, we always have a wait list that we always lean on. And the other part of that, too, is we always try to give at least 2 to 3 months notice so that we can make ample travel arrangements and things as well.
Right. Wonderful. Great talking to you, Jon. Thank you for being on the podcast.
Oh, thank you so much for having me. This was wonderful. I appreciate you spreading the message. And if anybody wants to learn more, our website, worldhealthdental.org.
Wonderful. You'll have more people visiting your website soon. All right, people, goodbye. Thank you so much for joining us on this episode, and see you again in the next episode where I get to meet another amazing change maker. Till then, goodbye.